So welcome. Thank you for coming today. The 2025 annual election period presentation for Priority Health Medicare Advantage Plans. Here at Cornerstone, many of you know our team, but we just really want to put that out there so everyone recognizes us. This is our healthcare team. As you know, Nancy Corser here in the middle. Going over to the right, we have Amy Orr, and then myself, Kristen Rushlow, in the middle. And the three of us are the three independent agents that are in the office. So we all do the same thing. And then all the way over to the left there, we have Becca Liu, who is our client service coordinator. Becca helps us with a lot of administrative duties, and she actually also just passed her state licensing test too. So she has that as well. All right, so today, what are we talking about? We're going to be talking about the Medicare Advantage plans, the big window that's right upon us, the annual election period, AEP. It's that one important time of the year that you can make changes to your Medicare Advantage plan. So the annual election period will begin October 15 and it ends December 7. If any of you make changes during this time to your Advantage plan, it will become effective January 1st of 2025. We're going to talk about some new rules and Part D changes that are coming that will be affecting everyone who's on Medicare. We'll do a little refresher of the Medicare Advantage plans and how exactly do they work. And then for the moment everyone's been waiting for, Amy is going to talk about the 2025 Medicare, the priority health changes specifically to the plans and the highlights along with benefit reminders. So CMS government rules and regulations, of course, they always have rules and regulations. There's really not a lot that's changing for 2025 in this aspect. We're practicing this right now in 24 as well. So just to remind you, if we do have a phone conversation with you or a Zoom meeting for your appointment, all phone and Zoom calls will be recorded. We have to keep those on hand should we ever get audited. And then that lovely scope of appointment form. Now we need this prior to anyone's appointment, at least 48 hours before the appointment. So we're trying to be really proactive on that. Many of you have probably already completed it and sent it in, but we do have a nice link that you can complete that through, and it's very easy. But that scope of appointment form, we do need 48 hours before the appointment. Otherwise, we would have to reschedule. And with that too, once you sign the form, it's good for 12 months. So if you schedule an appointment, we'll send you that email. If you can complete it as soon as possible, the sooner the better, because then we just have it in hand and we're good to go for your upcoming appointment. And then the disclaimer. So if you've been in email communication with us, you've definitely seen this. It's in our signature line. And also this is something that we have to start saying when we're on a phone or Zoom call with you. So just bear with us. This is a little verbiage that we have to read because those calls are being recorded, and just to let you know what types of plans that we do offer. I will not read it for you right now, but you'll hear it again later. Okay, so let's get into what are some of these big changes that are coming for 2025. So the Inflation Reduction Act that was put into play in 2022, this is the reason why these changes are rolling out. And so this slide and the next slide, we're really going to talk about what these changes will be. So the key effective changes, one of the big ones for 2025 is the donut hole or coverage gap. It's going away. So for some folks, that is going to be huge because they were spending so much money on their prescriptions. Once you got bumped into the donut hole, this act is getting rid of the donut hole. It's going to put a limit on the annual out-of-pocket drug costs that you would pay, and they're going to cap that at $2,000. So that's going to be for covered Medicare drugs for the Part D. They're also going to make sure that the Part D plans offer a prescription payment plan. So this one is new to all of us, of course, but it's not going to be the best fit for everyone. And that's something that too in your appointment we would talk about. Should we see that you might be a good candidate for this? A good example would be maybe in January, you go to fill your prescriptions and it's going to cost you $600 or more in January to get your prescriptions, then you would be a good candidate for this program. It is a program that you have to opt into. They will not automatically put you into the payment plan. And in order to get enrolled into it, you have to enroll through your carrier. So in this instance today, you have Priority Advantage Plan. You have to contact Priority Health first before you would go to the pharmacy to be able to pick up those prescriptions. You, of course, would need to know what it's going to look like, that cost first. So it might be a little touching points, right? Like you go to the pharmacy and then now you have to go back and call the plan to opt into your payment plan. But we can talk further about that on a one-on-one basis too. The Part D plans and drug manufacturers, it requires the Part D plans and drug manufacturers to cover more of the drug costs. So it's taking the cost off of you and it's putting it to the manufacturers and the insurance carrier. So what are some of the future Part D enhancements that are coming? So as we get outside of 2025, there's still other years that this Inflation Reduction Act, it's going to continue to be impacted. Medicare is negotiating with the manufacturers of the below brand name Part B and Part D drugs that don't have competition. So meaning that they don't have generics, right? This big one on the first bullet point here, effective for 2026, you will see a reduction in some of these prescriptions, but the big one, Eliquis. I know a lot of people that are on Eliquis. It's effective drug, it works great, but it's really expensive. And right now, with the donut hole around, usually if we see someone is on Eliquis, we automatically know they're going to go into the donut hole. So this will be a really good thing. And then each year after, they're going to be rolling out where they're going to be picking another selection of drugs. So as you can see in this year or next year, 2025, they will pick another 15 Part D drugs, and then those will become effective in 2027. So it does take some time. It takes 2 years actually for them to do this negotiation and get everything going, but they have it set up. So it's going to just keep rolling out, as you can see. It looks like once we get into 2029, now they're going to be selecting 20 Part B and D drugs. And then after that, every year, they'll keep doing this. So the manufacturers who do not comply with this, they will be penalized. So what else to expect in 2025? I think this is a really good one. So the Advantage plans are now going to be sending out a mid-year notification to those policyholders. There's a lot of benefits that are built into your plan, right? And if you're not using all of them, well, this is how the carrier has figured this out. So a study by the Commonwealth Fund found that only 3 in 10 beneficiaries, they did not use all of the supplemental benefits that were built within their plan last year. So that's a lot of money that the carriers put into the plans to design these certain things. So we'll say like the gym membership or maybe the over-the-counter allowance, things like that. If they're not being utilized, then the carrier they might have to revamp their plans, and some benefits might start to go away if they're not being utilized. They can put that money elsewhere. Like where else is the plan being used the most? So starting in 2025, come July, you should see your mid-year enrollee notification of the unused supplemental benefits. And again, I think this is just a great thing. It's a great reminder too, to show you halfway through the year, hey, I'm not using this benefit. I kind of forgot about it. And they'll actually include instructions on how you can access these benefits. So it's a good thing. And then you'll also be able to see the details of the scope and the out-of-pocket costs. Where are you halfway through the year? Have you almost met your maximum out of pocket? Or maybe you haven't even really touched it because you haven't used the plan very much. So Priority Health, why we're here today, the Advantage plans. Now we are going to get into some of the Priority Health stuff directly. So this is behind all that Priority Health does. So their purpose is to help our members live full and vibrant lives by easily navigating their physical, mental, and financial health. And then their promise to you at Priority Health is providing personal service with respect and dignity, constantly making our members' health their top priority, and partnering to give them access to the care that they need. And with that said, they won number 1 in customer satisfaction among Medicare Advantage plans in Michigan, and they got the J.D. Power Award. So that's a big deal for them. All right. So moving to these Medicare Advantage plans. A little refresher of the Advantage plans. So they're often referred to as Part C. They're coming in and they're an alternative to Original Medicare. What's Original Medicare? It's just the A and the B. Over here, we have our hospital insurance and then that medical insurance. Medicare Advantage plans, they're offered by private insurance companies and they cover hospital, medical, and then in many cases, the prescription drug piece is built right in. There are some Advantage plans that do not have the Part D aspect built into it, but many of them do. And that might be more fitting for somebody who was a veteran. And then in addition, the Medicare Advantage plans, typically they include a lot of extras, right? That we just mentioned some of those. And we'll talk about here in a little bit, but extras like dental, vision, and hearing, a lot more. Plus they have low co-payments or low premiums on the plans too. Okay, so who might be a good candidate for an Advantage plan? Medicare Advantage plans, the best option is for an individual who they want to pay a lower monthly premium if that's important to them. If you want more coverage than what Original Medicare A and B offers, because then it, like I just mentioned, it's giving you that extra Part D, the prescription drugs, and some of those supplemental benefits, vision, dental, hearing, a gym membership, and more. They offer predictable co-payments so that you know when you go to have an outpatient procedure, you know the range or maybe even exact dollar amount of what your co-payment is going to be for that procedure. This is also for individuals who like having just one plan, one card. And by one card too, I mean for their medical and pharmacy needs, because we all know that you get 3 cards because there's other things that you get, your travel pass and the over-the-counter. But when we're talking about your medical, it's just that one card. And then knowing that you have a certain dollar amount, your worst case scenario, that maximum out of pocket for the year, which allows you to be protected financially. And then also some people who like the idea of using a network of providers because they know that if they stay in their network of providers, they're going to save money. So basically, it's a great fit for most people. So here's an interesting one and just kind of good to know, I think, exactly how your plan works and how it all comes together. So how does this work? Medicare is funded by the contributions that individuals make through their Social Security tax and then their Part B premium. The Part B premium, it's not insignificant because in 2024, most people are paying the $174.70. Now, from 2023, that went up about $10. And then looking into 2025, it's likely that it is going to go up. We actually don't have those numbers yet. They have not officially been released. But once you come for, if you did need a AEP appointment to review or make a change to your plan, we will have that information by the time that we can make those changes. So October 15th, but we keep checking and those numbers have not been released at this time. Last year, they were released October 12th. So hopefully any day now. Many of the plans or carriers even now are offering some kind of Part B rebate or give back with the Part B premium. So basically that's going to give you a little bit of money that you don't have to pay for the Part B premium to maybe offset a retiree's expenses. So back to how this all works. The government takes all of these funds, so all the Part B premiums and the Social Security tax for the entire country, and then they place that into number 2, the Medicare Trust Fund. When an individual signs up for a Medicare Advantage plan, that gets the notice sent to CMS, and then the payment from Medicare it goes to the Medicare Advantage Plan, to the carrier out of that trust fund. So then down here, now we're going to priority. So then priority gets that money. So now this is where that slide before comes in hand, where they want to know that you're utilizing all of those supplemental benefits because they get a certain chunk of money, right, to build your plan. And if benefits are being utilized, they're going to have to make changes. It then becomes the Medicare Advantage Plan's responsibility to provide health benefits to the Medicare beneficiary, including managing and coordinating an individual's healthcare and providing that customer service and then paying the members' claims. So, looking at the Medicare or the annual election period, the big window that we're all talking about right now, our very busy season. It'll kick off October 15th and it will go until December 7th. During the AEP Medicare Advantage, eligible folks can enroll or disenroll from their Medicare Advantage plan. You can also stay in your plan, and during this time, maybe you wanted to add on the enhanced dental and vision. That's something that you can do during this time too. If you do nothing, your plan will just roll into the next year. Members are during this window actually able to complete multiple applications. If you decided, I'm going to try this plan, and then maybe you change your mind, whatever changes you make during this window, the final one that you have submitted and that is done on December 7th, that's going to be the plan that's going to become effective then for your coming year. And then CMS tracks all of this and notifies the carriers if you do move to a different insurance company. Okay, this is another window that we as agents, we're not allowed to market, but it is something that you should just be aware of. It's a Medicare Advantage open enrollment period. It's kind of for those people who, if you missed the AEP window, you actually have this other one time of the year opportunity to make a change, but it is only for Medicare Advantage plans. So this window, January 1 to March 31st, you have that new 3-month window. And if you make a change then, it's going to become effective the first of that next month. So if you waited until March, it'll become effective the next month on the 1st. Again, we're not allowed to market this or really advertise it, say, hey, come and change your plan during this time. Ultimately, we really don't want the AEP window to roll into this and have this window be just as busy. But it does give people that extra opportunity to make that change if you had missed the AEP window. So just good to know. And then for the moment you've all been waiting for, now we're going to jump into 2025 and the new plans and all the new changes that are coming to priorities. So I'm going to pass this over to Amy.
Hello. There's going to be a lot of information on the slides that are coming. I'm not going to go over every detail. We did actually send you the slides as well, but I will try to highlight the changes and give you kind of a high level overview of each plan. And I just want to let you know, you may have noticed these slides have Priority Health on them. It's because most of this presentation came directly from Priority Health, and it is the only printed version of the information that we're allowed to share with you because it's been approved by CMS. So that's not our rules, it's not Priority Health's rules, it's Medicare's rules. But I will try to highlight for you where some of the changes are compared to this year. So Priority Health is actually offering 10 plans in 2025, believe it or not, still a lot. And there are 6 plans that have a $0 premium, and there are 4 plans that actually have a premium. You'll notice on this slide, there's different regions. So over on the right, you can see the state of Michigan, kind of find where you live. Many of you probably live in Kent County, which is Region 1, or Ottawa County. But I think there's a few folks on this webinar today that may be in Region 2 or Region 3. So just kind of make sure that you know what region you're in, because as you can see, like the Edge, for example, is not available in Region 3 and 4, nor is the Vital. So just make sure that when you're thinking about the plans, it's available to you in your region. That OSB on the side, that buy-up is actually just another name for the Enhanced Dental and Vision that is available on most plans. And that DSNP, just to let you know, that first one listed there, that's the dual special needs plan. That's actually for people who are also on Medicaid. We're not going to really focus on that today, but just wanted to help you understand what that is. There are also 4 plans that have a premium. This year, they're actually available throughout the state. And the premiums kind of range from $18 to about $118 a month. And again, that's going to vary by region. So Priority Health this year has decided to divide their portfolio into 5 categories based on kind of how they see the coverage being provided. So those coverage areas are wellness and prevention, well-rounded coverage, core medical, high medical, and then that special needs plan that I just mentioned. Some other things to just note as a whole, on every plan this year, it's going to be a $0 copay to go see your primary care provider. So that's a good deal. And also just a reminder, all of these plans include preventative dental, vision, and hearing. Certain plans add additional coverage, but the preventative is built into all the plans. One other thing just to take note of, the OTC Plus, the over-the-counter plus program that was available this year, that allowed you to use your over-the-counter benefit to also buy healthy foods if you qualified. And I know we worked with a lot of you over the course of last AEP to get you qualified. Unfortunately, that is no longer a benefit on these plans. It's only available with that dual special needs plan for the folks also on Medicaid. So just wanted to make you aware. Most plans still have an over-the-counter benefit. You're just not going to be able to use it on healthy food next year, unfortunately. Also wanted to just let you know that Priority Health has 1 drug formulary for all the plans. But the one thing we did notice that has changed on most of the plans, all but one of them, if you have a tier 3 medication, it's going to be a co-insurance for 2025 instead of a copay. That just means it's a percentage instead of a set dollar amount. The other thing you probably noticed if you looked at your annual notice of change is that on many plans this year, there is going to be an in-network medical deductible. So this slide just shows you what does and what doesn't apply to that deductible. And really, your routine care, the good news is your routine care does not apply to the deductible. So you go to your primary care provider, you go to your specialist, maybe you have physical therapy or occupational therapy, or you get labs done. You have to go to the emergency room or urgent care. None of those things apply to the deductible. Your durable medical equipment doesn't apply to the deductible. So what does? If you have something larger, so if you go in the hospital or skilled nursing, maybe you need cardiac rehab or pulmonary rehab, or you need an MRI, or you need an outpatient procedure. Maybe you get your knee replaced, hip replaced, those sort of things. Those, maybe you need dialysis. Those are the things that fall under the deductible. So just keep that in mind as you see this deductible on some of the plans, that it doesn't apply to everything. Let's talk about this first category, wellness and prevention. This is these two plans are new to our area. And these plans are designed for those individuals looking to prioritize their physical, mental, and sexual health. They give some additional benefits to help in that area. The Thrive plan was previously not available to us in our area, so that's new. They're both PPO plans. The Thrive Plus plan, a plan that was on the 2024 lineup, was the Ideal plan. It is not going to be available next year. And if folks are on the Ideal plan this year and they don't make an active change, they will automatically be switched to the Thrive Plus for next year. Let's take a closer look at this plan. So the Thrive, again, is a PPO, and it has a $0 premium. The maximum out of pocket does vary by region. You'll see for most it's $5,700, but in regions 3 and 4, it is $5,900. And this does have a medical deductible. And again, that varies slightly by region, $240 versus $570 in regions 3 and 4. PCP is $0. Specialist is $40. One other thing to note with this plan specifically is that if you are on this plan and you go to a dermatologist to have a skin check done, it's actually a $0 copay. Again, they're all about wellness and prevention in this category. This also does have some embedded dental in addition to the preventative. You can see it has comprehensive, that's what that C stands for. It has $1,500 that you can use for fillings, crown repairs, and simple extractions. The other unique feature of this, you see, is a flex card. And that's your OTC card, but your OTC card is going to actually have kind of two purses in it. It'll have one purse that's your $60 per quarter over the counter, but then it also has a second purse of $185 per year that you can use towards fitness and wellness. So you can use it to buy fitness equipment, go to a different fitness facility or something that may not be covered under the gym membership. So it gives you some additional nutrition supports, another thing that you can use that for. So it's just an extra wellness feature that's built into this plan. And this plan also adds a supplemental drug list. So in addition to the formulary, this plan is going to also cover generic ED drugs. So Viagra and generic Viagra and generic Cialis are actually going to be covered as tier 2 and tier 3 drugs on this plan. But keep in mind that those are typically not a Medicare covered drug, so they won't roll into that $2,000 maximum that Kristen talked about. It will be in addition to that, but at least you would have coverage if that was something you were interested in. This last item, this cancer screening test, it's a $150 copay every other year. Again, it's something unique to this plan. And you do, in addition to having to be on this plan, you have to have one of 3 risk factors on top of that, an HPV diagnosis, or you have to be a smoker or have a history of having smoked, or you have to have an elevated body mass index. So again, they're all about prevention in this plan. And so they've added that as well. The Thrive Plus, this is kind of just a bigger version of the Thrive. It does come with a premium, $39. The maximum out of pocket is $5,600. Again, but on this one, there's no medical deductible. And again, $0 to see your primary, $40 to see the specialist. This one too offers that $0 copay to get a skin check done at a dermatologist. You can see your inpatient per day, $300 per day for days 1 to 7. Has a really low physical therapy copay of $15, which is nice. And then this dental is a little beefed up. This is one of the highest dental plans that they're offering this year. So this and the value plan that we'll talk about later have comprehensive dental built in. Again, in addition to that preventative dental, they give you a bucket of $2,000 that you can use towards, again, the fillings, the crown repairs, and the simple extractions. But this plan also lets you use, gives you a 50% coinsurance for root canals. Again, specific to this plan, but that $2,000 bucket can also be used for root canals. This one, like the other Thrive, has the 2 purses on your card. So you have $50 per quarter for over the counter and $285 per year to be able to use toward those fitness, wellness things like, again, like the fitness facilities or fitness gear or nutrition support. And this too has that cancer test. This one allows you to do it every year for a $75 copay. But again, you just have to remember you have to have one of those three risk factors of either HPV diagnosis or having been a smoker or current smoker, and then the elevated body mass index. And again, keep in mind, this one does also have that added coverage for the ED drugs, the generic Viagra and Cialis, but once again, that will not roll up into your $2,000 MAC for the Part D. Well-rounded coverage. So this section is really designed to meet the needs of everyone. It's solid medical coverage with some extras. And those extras are what we've all kind of come to know and love. So there's 3 plans in this category. There's the Key and the Value. Both of those are HMO POS, so Health Maintenance Organization, point of service. And then the Vital plan is a PPO. Let's take a closer look. The Key plan is Priority Health's largest plan, and it's for a reason. They've got great benefits on this plan. Again, the HMO POS sort of operates like a PPO. It does let you go out of network. So it does give you that flexibility, but just remember there's a separate out-of-network deductible if you do see an out-of-network provider. So this plan for this year will have an in-network medical deductible that you see on the screen, $275 in regions 1, 2, and 5, $250 in regions 3 and 4. The out-of-network medical deductible. So should you choose to see an out-of-network provider, that out-of-network deductible is $1,500. So just be sure you're aware of that. In terms of changes from last year, the maximum out-of-pocket did go up slightly from $5,000 to $5,500. The specialist copay actually went down slightly from $45 to $40. The hospital inpatient went up just a little bit. It is $350 a day for days 1 to 7 instead of $320. Just to call your attention to over the counter, it does again vary by region. So you can see the differences there. And overall, it did go down a little bit. The dental still has the dental embedded in this, the comprehensive dental, but it's a little bit lower this year. So this year you had a $2,500 bucket. Next year you will have a $1,500 bucket. And that again can be used for fillings, crown repairs, and simple extractions. And physical therapy, that copay did come down slightly from $30 down to $25. The value plan. Value plan is an HMO POS, so you do have the option to go out of network should you choose. There is a premium associated with this plan, and it varies by region. And just to give you a sense, if you are in region 1, so Ottawa County, that's $18 premium. If you are in region 2, $32. And if you're in region 3, it's actually $69. The maximum out of pocket on this plan is $4,900. And this plan has a 0 medical deductible when you're in network. Okay, again, in-network, but because it's an HMO POS, it does have an out-of-network deductible of $1,000. The specialist copay on this is $35, and the hospital per day rate stayed the same at $325, but they did add 2 extra days that you're responsible for versus this year. So this year it was days 1 to 5. Next year it's going to be days 1 to 7. The outpatient copay, so if you have an outpatient procedure done, did go up from $225 to $325. Keep in mind, there's no prescription deductible on this plan, so that's good. And something new to this plan for next year, it's in addition to the preventative dental, they've added comprehensive dental, very similar to the Thrive Plus we talked about. It has the $2,000 bucket. And again, it adds the fact that you, in addition to using it for fillings, crown repairs, and simple extractions, you can use the comprehensive dental on this plan for root canals as well. The over-the-counter, you can see, varies by region, $50 per quarter in region 1 and $25 per quarter in all the other regions in the state. And they dropped the PT copay on this pretty significantly. So for physical therapy, instead of a $40 copay for 2024, it's actually going to be $15 in 2025. The third plan in this section is the Vital Plan. Again, this is a PPO. It's an open network PPO, so it gives you the ability to see any doctor in the state of Michigan that you would like to see. And this is a plan that has that Part B buyback that Kristen mentioned some plans had. So this year, the buyback provided $30 per month, given back to you for your Part B premium. Next year, it's actually going to be $45. So if you have your Part B premium deducted out of your Social Security check, your Social Security check will actually be, there'll be $45 less deducted out of that. If you get a quarterly bill, your bill will be $45 less per month when you see that Part B premium. So what's changed in addition to that additional Part B give back? The maximum out of pocket did increase just slightly from $5,100 to $5,600, and they did add a medical deductible to this plan. Again, it's in and out of network because you're talking about a PPO, and that's $375. And just remember that doesn't apply to everything. It typically doesn't apply to your routine care, but it does apply if you go to the hospital or have some more serious things done. The outpatient hospital increased from $300 to $350. Urgent care went up just by $5 from $50 to $55. Your over-the-counter allowance went down just a little bit. It was $30 per month this year. It's going to be $25 per month next year. Physical therapy also went down just a little bit from $40 to $30. This does continue to have comprehensive dental. And it was $2,500 this year. It's going down to $1,500. And again, that goes for fillings, crown repairs, and simple extractions. And this plan does continue to have the hearing aid benefit, which I know folks really enjoy. So, but it did change from being every year to every 2 years. So with this plan, you can get the advanced hearing aids through True Hearing, one per year for a $0 copay every 2 years. So that's a good thing to notice if you are going to be needing hearing aids. That's a valuable benefit. The other thing to notice on this plan is that it does have a prescription deductible. It's $350. It only applies to tier 3 and up. And one thing we did notice, this is the only plan, I mentioned it earlier, that when you look at the prescription tiers, tier 3 is a $42 copay instead of a co-insurance. So that's just something to know. And again, your deductible for your prescription does roll into that $2,000 maximum that Kristen mentioned. So our next category, core medical coverage. There's 2 plans on this. It's the Edge and the Vintage. And these plans are designed for people who kind of value your medical coverage over the extras. So you might see a little bit less of the extras on this. But you also want a $0 premium, and you can be confident that you're going to get high quality and affordable medical care. And I know we have a number of folks that are on the Edge plan. I'd say the Edge is probably the second most popular plan to the Key in terms of Priority Health lineup. This Vintage plan, I just want to point out, is a new plan for 2025. I think there's a few folks on the call that are on the one plan. And if you are on the one plan and you don't actively make a change this year, you will be what they call crosswalked or moved into this vintage plan for next year. Let's talk a little bit more about the Edge plan. Again, it is a PPO, so you can go in and out of network. It is a $0 premium. The maximum out of pocket did go up a little bit this year. It was $5,300. Next year it'll be $5,700. It does have a medical deductible of $195, which really is one of the lower medical deductibles on any plan. Again, primary care, $0. Your specialist actually went down from 45 down to 35. The hospital per day rate went up from 320 to 350. And the outpatient copay also went up just slightly from 325 to 350. Over the counter, this is a change. This year it was $95 per quarter. Next year it will be $25 per month. So it's a little bit of a decrease and also a shift as to how it gets loaded onto your card. Biggest change I want to point out here is there is no more Papa Pals. So Priority Health is actually no longer contracting with Papa Pals. So it's not available, that benefit's not available on any plan for 2025. They've discontinued that. For those of you who don't know what Papa Pals was, it just provided some extra help with light housekeeping or chores or getting groceries, different things. And I know there's a number of folks who really relied on it, and I'm sorry to see that go, but it is not available any longer on Priority Health. The unlimited caregiver support that you see on the screen is actually a new benefit, but it's not the same as Papa Pals. It's just someone that you can connect with that can help you find resources, but it's not providing those resources directly. So this new vintage plan, it is an HMO POS, so you can go in and out of network, but just reminding you that there would be an out of network deductible. And it's a $0 premium. The maximum out of pocket is $5,300, which is a little higher than what it was on the one plan. The one plan was actually $4,300. There is no in-network medical deductible, but there is a $1,500 out-of-network deductible. So if you would choose to go out of network, you would pay a deductible. I do just want to also point out that this plan is only available in regions 1, 2, and 5. So if you're in region 3 or 4, unfortunately, this plan's not available for you. The specialist copay is $35. One other thing I do want to point out is with this plan, you don't get any over-the-counter allowance and you don't get a gym membership. So again, this is really focused on the medical. So they've removed those two benefits in order to give you more medical benefits. You do get preventative dental and $100 eyewear allowance built in, but you don't have any of the extra gym membership or over-the-counter. In terms of changes, the hospital copay increased slightly compared to the one plan. So it was $285 on the one, it's $320 next year. Outpatient went up from $285 to $350. Urgent care went up from $35 to $50, but they did and they slightly increased your PT from $20 to $25. Again, on the one plan this year, you had Papa Pals. It's not available. They do give you that unlimited caregiver support, but again, that's different than Papa Pals. The one extra benefit that this plan does provide, and it's unique to this plan, is transportation. So this plan provides 30 one-way trips up to 100 miles, and it is for health-related to health-related locations. So for folks that it's difficult to get to the doctor, get places like that, maybe to PT, this does provide 30 one-way trips up to 100 miles. It is through Safe Ride, and it does include wheelchair transportation, so that's important if you need it. They also added a reimbursement option, and that simply means that if you don't use Safe Ride, but you use a different transportation, and maybe, I believe it even applies if you maybe have a family member, you can submit it for reimbursement. High medical coverage. So these are highest coverage, but also highest premiums. And these two plans are actually Medicare or Priority Medicare's longest standing plans. It is the simply named Priority Medicare, and then also the Merit plan. They have low maximum out of pockets and no in-network deductibles. So the Medicare plan, this 19 years ago, this was Priority's flagship product. And it's their longest standing Advantage plan. And it's got great comprehensive medical coverage that you can count on. The premium does vary by region. For region 1, it's $70. For region 2, it's $75. And for region 3, it's $109. That maximum out of pocket is $4,500. So that's lower than what we've seen in many of the other plans. No medical deductible in network, but because this is an HMO POS, there is an out-of-network deductible of $500 if you would see someone out of network. $0 primary care provider, copay, $40 specialist, and $225 a day for days 1 through 6. Again, you can see that's a lower copay if you go to the hospital. If you have an outpatient procedure, it's $175. There's no prescription deductible. And it only includes the preventative dental, and there's no over-the-counter benefit on this plan. You do have the gym membership, but you do not have over-the-counter. Merit plan, again, this is a PPO, so you can go in and out of network. It's got comprehensive coverage. If you are on the select plan, there was, in 2024, part of the lineup was a select plan. That plan's going away. And if you don't make an active change from the select plan, you will be moved into this merit plan for 2025. Premiums, again, vary by region, $59 for region 1, $72 for region 2, and $104 for region 3. The PCP copay went down to $0 from $20, and the hospital went down to $275 for days 1 through 6 from $375 for days 1 to 5. So that's actually a drop in overall cost as well. And again, there's not going to be any over-the-counter benefit this year. It was $25 last year, and the maximum out of pocket on this plan is $4,100. So now let's talk about, just look at a little bit more details about the embedded extras. It's what everyone loves about the Advantage plans. And with some of the changes for this year, they don't look exactly alike, but there's still a lot of embedded extras that come as part of your plan. This chart just kind of shows you a big version of what each plan has and doesn't have. So you can kind of get that overview. Again, Papa Pals, just reiterating, that's no longer available. Mom's Meals is also not available any longer as a priority health benefit. That was a benefit that if you were in the hospital, it provided meals when you came home. That's not actually a benefit any longer directly through priority health. It is a benefit, though, that you can pay for through the new fitness membership. So Silver Sneakers is no longer going to be the vendor for the gym membership with priority health. It is now going to be Optum One Pass. And again, just to keep in mind, that's available on all the plans except the Vintage. Brain HQ, which was tied to Silver Sneakers, is now instead going to be CogniFit, that will become coming to you through that Optum One Pass. There's also a new over-the-counter vendor. And before we get too scared about that, because the change didn't go well the last time they made that, they promised us, they learned their lesson. They asked lots of questions up front, and they did their homework. So this will be a smoother transition for you. It will be to Links. So that is the new provider. And again, you can see that the Medicare plan, the Merit plan, and the Vintage plan do not have over-the-counter allowances. And just a reminder that on all priority plans, if you do have an over-the-counter allowance, it does not roll over. It's use it or lose it. So if you get it per quarter, use it during that quarter, it will not roll over to the next. If you get it per month, use it that month because it will not roll over to the next. I also did mention that caregiver support that Carol out, again, that's not Papa Pals. They don't do the light housekeeping. They don't do the chores. They're simply care advocates that kind of have life experience that can help provide assistance to caregivers to help you connect to resources that you might need. Just a little, again, these are the embedded extras. Non-SNP just means that we're not talking about that special needs plan. This gym membership, we'll talk about a little bit more in the next slide, but it's it's a good thing. It's in addition to still being able to use it at MVP, you get to also use it at places like the YMCA, Orange Theory, Stretch Lab. So it's actually expanding where you're going to be able to use it. Dental, again, I mentioned this, all the plans have preventative, and then some plans have that comprehensive dental embedded as well. Vision, you get an annual refraction and eyewear allowance. Hearing aids, again, through the True Hearing, you can you get a free exam and tiered co-pays, or if you're on that value plan, you get the $0 hearing aids. That CogniFit is for kind of mental fitness, and that comes with your new OnePass membership, and you have that over-the-counter allowance. Also, just a reminder with the dental that it is the Delta Dental Network. And so that's always important to make sure that your dentist participates with Delta so that you get your best benefits. So this is just a little bit about the new OnePass. And again, you can see that there's some great additional networks available to you. Holland Aquatic Center, the Downtown Y, which is exclusive to Priority Health. You can go to Planet Fitness, Anytime Fitness, Snap Fitness, lots of different places. You will have, you can see over on the right, you'll have several different options for getting your member code. You can call OnePass, you can visit their portal online, stop into a gym, but Priority Health will be mailing you instructions by the end of December as to how to get that OnePass number so that you can continue to use your gym membership as you have in the past. This is kind of what it's going to look like when you get your new over-the-counter card. Just a few things to point out. Costco is going to be part of the network, so that's an important thing. You can use your card in store at Costco, CVS, Meijer, Walgreens, Walmart. You can also shop online. And they will have a catalog. We've been told that the catalog, this new catalog is going to actually be 30% cheaper than the catalog was before. So that's a good thing. There is a new app. You can see that over on the side. It's Priority Health OTC. So you'll want to download that so you can use it. That QR code right there will get you right to being able to download it. One thing to really note with this is Priority Health is taking customer service for over-the-counter and brought it in-house. So that award-winning customer service that Kristen talked about will be available to you when you have a question about over-the-counter. You'll be able to call Priority Health directly and ask your questions. So that's going to be an additional benefit to changing to this Links provider as well. Enhanced dental and vision. This is available to you to add to your plan. So we've kind of talked about with each plan, either they had preventative or they added a little embedded comprehensive, but you can also, if you want more coverage, it is available to you. These are buy-ups that you would pay a premium for. You can see the premium there depending on your plan. And it adds additional $2,500 so that you can use. So depending on what your plan already covers, it lets you also get a new crown or dentures or bridge repair or implants. Just something to point out on the Value and Thrive plans, they had already added that coverage for root canals. This plan, those two plans, if you add the enhanced dental and vision, it can also be used for bridges. So that's just something to point out if that's something you might need. Really, the enhanced dental and vision is very dental heavy with an additional $2,500 coverage, but it does also add $150 and an additional eyewear allowance on top of what is included in your plan. All right, just a reminder too that you do have travel benefits as part of your plan. So you will get a card, you'll get your Priority Health card, but you also get your travel pass. That lets you have out-of-state travel benefits at in-network prices. You can see any provider outside of the Lower Peninsula of Michigan who participates with Medicare, even for routine visits. There's a multi-plan network that's going to be on your travel pass, a number you can call, and they'll help you find providers who will actually bill Priority Health directly when you seek care out of Michigan. And just also a reminder, you always have unlimited worldwide emergency and urgent care. So you can always go and get the care that you need regardless of where you're traveling. They also provide Assist America, and this is just worldwide travel assistance when you're more than 100 miles away from home. They'll help you coordinate care during a medical emergency. They'll help you find a doctor or a pharmacy wherever you are. They'll help you fill prescriptions if you're away from home. They'll help you locate your lost luggage, and they'll even provide some pre-trip assistance to help you prepare for travel. So just to summarize, we throw a lot of information at you. There are a lot of benefits that do come with your plan, and we do want to make sure that you're taking advantage of all of them because many of them are at no cost to you. Just again, a reminder that open enrollment is almost here. It's October 15 to December 7. Any change you make during that time will take effect January 1st, 2025. Maybe you've seen all this information, you've looked at your plan, you've looked at your annual notice of change, and you thought, I'm okay. There's nothing for you to do. If you want to stay with the same plan for next year, you don't have to do a thing. Your plan will automatically roll forward into 2025. But maybe you saw something and you thought, I think that there's a different plan that I'd like to change to next year. We can help you with that. So you can schedule an appointment with us. We can meet in person, we can meet on the phone, or we can meet on Zoom like we are today. And just a reminder that if you do want to meet with us to make a change, if you haven't already, please submit your Retire Flow survey. And if that's you're thinking, what's Retire Flow? That's our new program that we're using this year that lets you provide your prescription and provider information and do your scope of appointment. That form that Kristen mentioned earlier that we need to have, you do it all in one place with Retire Flow. And that QR code that you see on the screen, you actually can scan that with your phone and it'll take you right to Retire Flow if you haven't already filled it out. We do ask you to fill that out right away, even today, even if we ask you to actually do it even before you've requested an appointment so that we have that in hand because it's required for us to be able to hold your spot because that's the information that we need to be able to prepare to meet with you.